of Georg Kavanchik, Jerusalem, Israel. Thank you very much for attention.
You have time to take a couple of questions?
Yes, sir.
So, Thomas?
So the evidence you presented in favor of this trial was very heavily relying on a surrogate marker. This is the T2 star signal in the dentate. So if you rely on this surrogate marker, one should know more about that. So one should know whether it's related to disease severity. One should know whether it's related to disease duration, whether this progresses with the disease duration. And one very crucial question with respect to these MRI parameters is that you need to know the stability of the signal. So this is a parameter that completely depends on the magnetic properties of the scanners, and they change over time. So your scanner 1 year later is completely different from the scanner now.
1 month, 2 months.
Or 1 month.
Very good.
And the further concern is that the dentate is not primarily involved in the pathology of euro-ATAXIA.
Yes, but we have looked where iron accumulates, and they nicely accumulate in that particular nucleus. I fully agree that this is probably the best possible target, at least to follow. Again, I am not claiming any clinical benefits at this point. I'm saying that this was our unique endpoint, and because it was an iron accumulation, and we have looked at the place where the iron accumulates mostly.
Also, don't forget that at least in advanced disease, the dentate becomes severely atrophic in Friedreich, so it's a severe neuronal loss. There was a question down there, then Hélène, then
Pierrot.
Pierrot, and then Sue. So, yeah.
I have two questions in fact. So the first one, I don't understand why independent easy test in the US, why in Paris you recommend independent since many years.
How can I answer this question? Ask them the question.
Okay, but it's a bit funny, you know, to have clinical trial somewhere, when in France it's a usual way to treat the disease. And the second question, you have no comment on that, it's regarding pre-implantation testing. Your name is cited in the French book of industry or Facebook. So I don't know if you are practicing pre-implantation testing on ataxia.
Yes, we offer PGD for euro-ATAXIA. The answer is yes.
And how many a year? How many a year?
Just beginning. We have started for long, but we are now facing the first application for PGD in euro-ATAXIA. The first ones.
But
this is not a common query. It's not common. But there is no reason to reject this.
But normally, it's the best way to solve the ataxia problem is from embryo not having the ataxia before.
I think this is a completely different discussion. We should move to another question. Yes, you and Pierrot.
So we had
Student Berman, Pierre.
we have now Hélène.
Okay, so I wanted to make a comment. We're actually seeing iron accumulation much earlier on. We're seeing iron accumulation much earlier on than what we previously thought by using more sensitive method. And also this it's back to the density because we're actually seeing iron accumulation also in the dorsal recovery and the mouse models.
Thank you. Very good.
If I may.
Wait your turn.
No, it's just I want an answer to Hélène because there's a paper out from Köppen in this year saying there's no iron accumulation with the attack in patients. in our pathological study.
We don't see it in the dental.
Well, it's
Not there, no.
no. Well, but in fact, Annie
No medical
Koppen wrote that also in the book on the cerebellum that we made a few years ago. The question is that the dentate becomes so atrophic that you get such a severe cell loss that at that point the total iron you get there is even less than iron you have in controls, but just because you don't get the nucleus anymore in practice. Because other MRI studies, like the one by Valdevogel in also have shown increased iron. So I think that's kind of a late event when the dentate is essentially lost. That's my feeling at least. If you look at the pictures, I have the pictures from okay. We have.
Actually, I was going to comment on Arnie Koppen's article, so it was already brought up.
All right. Pietro?
Yes, we came to study a new cell model for euro-ATAXIA, which are neuroblastoma-derived cells. And in these cells, we tested many compounds, including Deferiprone. And what we found, and what I presented just a time ago in the meeting, is that when you treat the cell with Deferiprone, you obviously decrease the iron in the mitochondria, which results in a loss of aconitase activity. Very significant one. I mean, you reduce to 20% or 10% residual in a few days. And in this cells, this results in the death of the neuron, so decrease of iron in the cell population. That there is a problem, potential with aconitase. Because as soon as you decrease iron in the mitochondria, you decrease aconitase even more than simply by eating the synthesis, but because the aconitase react to the level of iron. And I don't know how can do that.
But remember, this has not. This is very interesting. How do you divide the euro-ATAXIA model? Is it siRNA or?
We've used several cell lines. We use control cells. First, in control cells, this happens.
So this is not. They are not frataxination.
Then we shift to patient fibroblasts, which are frataxin